There are some risks with the egg freezing cycle. So first of all, sometimes the medication is given to stimulate the ovaries, but unfortunately the woman doesn't then produce any follicles. And then if she doesn't produce follicles, we cannot get eggs, so we have to cancel the cycle. With the stimulation of the eggs being developed and the estrogen levels will then go quite high, this leads to an increased risk of thrombosis, which means a blood clot developing. Usually it's in the leg or the chest. And this is something which can be dangerous, of course. So sometimes there will be blood thinners given to certain women who are high risk. And certainly we don't recommend long distance flying within 2 or 3 weeks from doing this egg collection procedure. And if you do have to fly, then you should be covered by a blood thinning injection, heparin injection, which your clinic should be able to provide. There's also a risk of something called OHSS, ovarian hyperstimulation syndrome. So when we stimulate the ovaries, sometimes the response can be too strong to the medication, and that can then lead to a reaction which can trigger fluid collecting in the tummy, fluid can collect in the chest, around the lungs. Sometimes the woman can become quite poorly and even need to go to hospital. Depends on how high her AMH is, so how many eggs she has, and if she has a higher number of eggs, then this is going to be a higher risk. And sometimes there are things that can be done to reduce the risk. So if the clinic is concerned, they may give albumin, which is a blood product in the form of an IV drip to further reduce that risk. Some clinics use tablets like cabergoline, for example, as well, to have a similar effect. But the most important thing really is to control the medication to make sure that this woman doesn't get too much medication, because the OHSS is really caused by medication. And if you can try your best to give just the right amount and not too much, then this will also limit the risk of ovarian hyperstimulation syndrome developing. Now, when we do freeze eggs, we need to fertilize them in a different way to conventional IVF. So conventional IVF, we do with good quality sperm, and we just put the sperm around the egg in a dish and allow it to fertilize by itself. But when we have frozen the eggs, because we have stripped the outer layer of the egg, we actually need to inject the sperm inside the egg. And it's done with a procedure called ICSI, as you can see in this bottom right picture here. Now, with ICSI, it has been found that this slightly does increase the risk of congenital abnormalities in the baby, and that's compared to natural conception. Now, most of the time when we do ICSI is because of poor sperm parameters, if the man has abnormal sperm, but with frozen eggs, even if the sperm is good, we still need to do it. And we're not sure why this slight increase of congenital abnormality is occurring. But even with ICSI, it doesn't guarantee that the eggs will fertilize. So we aren't sure 100% that we will get eggs fertilized. And it's not unusual that some of the eggs don't fertilize. And with frozen eggs, it's typically 70 or 80% that will fertilize. But sometimes it can be that, it's very poor fertilization. None of the eggs fertilize. None of the eggs survive the thawing as well. If you do come back to use these eggs, then this would be classed as an IVF pregnancy, and therefore there is a slightly higher risk for pregnancy complications. Pregnancy complications will include early pregnancy, like multiple pregnancy, miscarriage, ectopic pregnancy, which is where the embryo can implant outside of the womb, usually in the fallopian tube, and that can be quite risky. It's 3% with IVF compared to 1% with natural pregnancy. But also even late pregnancy complications are slightly higher with such treatments, and things like preeclampsia, which is high blood pressure and protein in the urine developing in late pregnancy, growth restriction of the baby, preterm birth. These are all slightly more common. And therefore, if a woman has frozen her eggs and is still of an age where she can try and conceive naturally, then she shouldn't rush back to use these eggs. She should try and have her baby naturally, or babies, and hopefully, she'll manage to complete her family naturally, and that's the best way to get pregnant. But if it does happen that she's not got enough eggs, or the eggs are too poor quality, or she's too old, or even if she's menopausal, then she can fall back to use these eggs.